In this video, we are going to see about open method impression techniques in implants. It was done in 3 to 4 sittings in the patient, and I have listed the instrument at the end of the video. First sitting is the impression making. Video quality is average since it has been zoomed. In UG days, it was not being taught to me, and I am learning this through CDE programs and some consultants. First, fabricate a special tray. Hole is made in the place where implant impression gonna made, and if you are going to buy custom tray, it will cost some 100 rupees. So fabricate special tray, it is economical one. And first you have to remove the conventional given to the patient. Implant coping is fixed to the implant. Check for the stability. After that, take a dental floss, tie with the implant coping all together, interlink them just like the video, and you can see the floss has been interlinked over each implant together. Pattern resin is applied over the floss. Pattern resin is available in GC brand. Once the pattern resin gets set, it will get hardened within few minutes on the chair side itself. Then check for the special tray fabricated. It should not have any interference with the pattern resin. It should be freely move inside and outside. If there is no interference, take a wax sheet to cover the hole for implant impression procedure. And the wax sheet is covered the hole to carry the impression material, and the monophase medium body where brand of Aview has been used. You have to inject them over patient vestibule, and you have to place the tray. Once the material gets set, you have to expose the coping through the wax sheet. We are exposing the coping with help of the probe. Once the coping has been exposed, take the hex driver and unloosen the implant coping. We are unloosening the implant coping one by one. After unloosening, we are removing the impression from the patient mouth. Give a slow, steady, firm pressure. And we have to cut the interdental space, making easy for pouring the cast. And you can see the impression which has been taken along with the coping. The patient sent again with the conventional. Thus the end of the first sitting of the patient. Impression has been made and the implant analog has been fixed to the coping, and we have to make the cast. Before making the cast, we have to use one more material to make the gingival mask using Gingivast available from the Germac. Second sitting is the jaw relation and bite registration. You can see the cast has been poured and analog has been retained to the cast, and the pink color is the material Gingivast. And the abutment has been fixed to the analog, and the abutment will be stabilized using pattern resin again, and we are unloosening the abutment to check in the patient mouth and the abutment has been fixed to the patient mouth. After fixing the abutment, you have to check it should not have interference with the lower. There should be minimum clearance with the lower opposing arch. In this patient, the clearance was not adequate, so we have to trim the abutment a little more using metal cutting bar. After trimming, it will be placed again to check for the clearance. You can see the clearance will be adequate. Should be minimum 1 mm of clearance with the abutment. It should not hit the opposing arch. We have to check it thoroughly. After adequate clearance been achieved, you have to make a denture base. Light cure material denture base available. We are gonna to use that, and you can see the first and third implant has been stabilized with the pattern resin, and gonna to unloosen them from the cast and place it in the patient mouth. And the denture base has been placed with the patient mouth. And it should have a minimum clearance. You should trim the denture base. In this patient, the clearance was not adequate. After that, occlusal rim has been fabricated on the denture base and placed in the patient mouth, asked to bite in the centric relation. Patient is asked to bite in the centric relation, and the bite has been achieved. And you have to cut the excess. We are cutting the excess in the patient mouth itself. And the bite has been recorded. Bite after bite has been recorded, we are gonna to see the lip fullness. Since it is a partial edentulous, we can easily check for the lip fullness. After the bite has been established, it has been checked with the model again. You can see the bite has been recorded in the occlusal rim. And the shade selection has been made using the gray card. Third setting patient trial and occlusal corrections. After that, lab has sent the fabricated metal ceramic screw retained one. We are going to check that again with the patient. We are unloosening them from the cast. And place that in the patient mouth. Tighten the screw using hex driver. After that, take the articulating paper, check for the occlusal interferences. Trimming the occlusal interference areas. After clearing the occlusal interferences, you have to again check for the patient. Once everything has been done, send the unit again to the lab for glazing and place the polished glazed screw retained FPD has been fixed to the patient. Armament used and the material and the name of the brand I am going to say it now. For impression, implant coping analog RR cold cured liquid. For special tray, pattern resin GC brand, dental floss wax sheet and medium body Aview brand. For model pouring, greenstone and gingiforst material for gingival mask available from Germac has been used. Jaw relation implant component abutment, patent resin GC brand, light cure denture based material OCO and wax sheet burner has been used. Third sitting trial articulating paper and burrs. Thank you for watching. Like, share, subscribe. Dear Madness Dentistry.